Um, Truth be told, drug abuse is a big challenge for us in Lamu. But I can tell you what we are doing. Number one, we have zero tolerance as far as drug pushers, the sellers, are concerned. I sympathize with those youth who have been entrapped into the habit of using drugs. But I have no sympathy for the drug pushers. And I, together with the security committee of this county, we are now pursuing, because those who are selling drugs are known. And I have sat with the security committee, and we are now following up and arresting them. Recently, there has been a case where somebody was arrested with very many kilos of bang in this town. And the following day, he was taken to court, which is a big improvement. Number two, together with the Red Cross, we have set up a big rehabilitation center at Hindi. And as a county, we will support those young people who are in drug abuse. We have also started treatment of methadone, both at King Fahad, and I will recently launch the methadone treatment also in Lamu East, and to be followed at Mpeketoni. And what we are doing is, apart from rehabilitating the drug addicts, we are also teaching them some skills so that when they come out of that habit, they are able to fend for themselves, because it is pointless to treat them and then just let them go back to their old ways. So these are some of the measures that we are putting in place. I have zero tolerance with drugs, and I have said, if a drug user is arrested and somebody goes to bail him or her out, I have said perhaps we should also arrest them, because they are accessories to the crime.
So, in light of how big a challenge it is, even to your own admission, by your own admission, you're saying that you've put up, rehab facilities facility alongside Red Cross. Do you have any that is exclusively owned by the county government? And if not, doesn't it kind of show like there's a disconnect between the situation and the efforts to create a solution, such that you have to rely on a partnership?
We do not have a facility, but as a county, the methadone treatment is being undertaken at our King Fahad Hospital. But the partnership with Red Cross, we gave them land, and right now I'm also going to provide medical staff to help. So it's a proper partnership. It's not that we are relying on them, but they came up and built a very good facility. And the whole purpose, that time, we were pushing together for a place where our drug users can get help. So I must confess that it's not owned by us, but we have very, very good relation with the Red Cross. We also, as a county, pay for the drug users to live in that facility. And if you get the time, I would invite you to go and see the facility, because it's also an innovation center where the same drug users, when we rehabilitate them, we give them a trade so that when they come out, they're able to stand on their own 2 feet.